My name is Dr. Masoud Saman. I'm a board-certified facial plastic surgeon in New York City, and today I want to talk to you about non-surgical rhinoplasty, or NSR. Some people even refer to it as liquid rhinoplasty, a cosmetic procedure whereby we utilize products such as dermal fillers, botulinum toxin, sometimes the combination of the two, and some people even use threads. I don't think it's a good idea in the nose, in order to change the shape of the nose in a temporary fashion. Non-surgical rhinoplasty has limitations. It does not achieve exactly the same things that you can achieve with surgery. As an example, in surgery, we can narrow the bony vault. We can truly increase the projection, or how far the nose comes out from the face, or decrease it, upturn or downturn the nose. We truly get rid of the nasal hump. In smaller noses or lack of a bridge, we can build up a bridge. And there's true manipulation of the function on the inside of the nose that we can perform. These true changes cannot be achieved with NSR, or non-surgical rhinoplasty. In fact, what we can do is create illusions by camouflaging lumps and bumps in the nose, by creating the illusion of a sharper tip or a more projected tip or a more rotated tip. Also, we can use botulinum toxin to weaken the muscles that pull the tip down or flare out the nostrils, to improve those aspects a little bit. So, as you can see, the products that we use, namely dermal filler and botulinum toxin, do not last forever. Generally, botulinum toxin can last somewhere between 3 to 4 months, maybe a little bit less in the nose if we use it here in this region, because we don't use so much, otherwise it would affect your smile. And the main product, which is the dermal fillers, depending on the filler type, can last somewhere between 6 months to a year. On average, I would say a non-surgical rhinoplasty will last that long, 6 months to a year. But it's similar to a gas tank. It's not as if you have this curve of a perfect nose and then a drop at 6 months. The product starts to deteriorate and degrade over time. Little by little, it goes away. And the next question I get all the time is about the safety of non-surgical rhinoplasty. The nose is a very vascular area. That means there's a lot of veins and arteries involved. These veins and arteries are tiny, and if they get occluded, there can be problems. So you have to make sure that you have your non-surgical rhinoplasty. It is an advanced form of filler injection. It's not just any kind of filler injection. You have to make sure that it's done by somebody who knows the anatomy of the nose, who does it safely and performs it in the correct plane and has done plenty of it. And also someone who can provide you with additional information on what to do, God forbid something goes wrong. So if done correctly, yes, it is safe. On the day of your appointment, non-surgical rhinoplasty works like any other dermal filler injection in terms of the process. You come in and I evaluate your nose. We do the measurements. We talk about your aesthetic goals and see if you're a good candidate and come up with a good treatment plan. We select the product that we would like to inject. We mark you up, numb you, and inject it. It's a very comfortable procedure. It takes about 10 minutes or less, and you see the results immediately. It's very gratifying. When you go home, you can ice the area. You can expect to have some swelling, a little bit of bruising, nothing major, for maybe a few days. Generally, I tell patients that to expect to have the final result of their nose at 5 to 7 days. And after that, you'll enjoy it for however long it lasts, between 6 months to a year. Patients love this procedure, but I am not here to tell you if it's worth it or not, because it depends on your goals. If you are absolutely mortified of surgery and cannot have it, then this is a good option in order to improve the aesthetics of your nose. If you're thinking about a non-surgical rhinoplasty in a pre-event, somebody's wedding is coming up, or you have a photo shoot and you'd like to decrease the appearance of your hump a little bit, I think that is also a good indication. But having it over and over and over and over If surgery is a possibility, might be risky because you increase the incidence of something happening, something going wrong. Also, fillers don't necessarily always go away. We have radiographic information and data that shows that fillers stay for longer than we thought, and they can be problematic in the body. So each individual patient's wants, desires, and just general conditions matter in order for us to see if you're a good candidate, and also if this procedure is worth it. I hope this video was helpful. I'm happy to sit down in a consultation and discuss your specific nose, your anatomy, and your wants and likes to see if we can come up with a good plan for you.